Hello, this is Dr. Sakir and today I am going to tell you about lupus or SLE. What has lupus to do with the wolf? If you know, the word lupus comes from the Latin word meaning wolf. It meant that a rash seen on the face, which today we call a butterfly rash, resembled or made the person resemble a wolf, and that is why the name lupus was given. And since it had systemic manifestations, it was called systemic lupus erythematosus or SLE in short. So what exactly is this SLE? SLE is a multi-system autoimmune disease. As you would already know, autoimmune disease is where your immune cells start attacking any of your organs. Very common autoimmune diseases are like your autoimmune thyroiditis, which causes you to take thyroid supplements, or it can be arthritis such as rheumatoid arthritis. But SLE is multi-systemic. It can affect various organs such as the skin, as I have said. There can be oral ulcers, ulcers inside your mouth or anywhere on the mucosal membranes. There can be various types of rashes all over the body. There can be hair loss, but there can also be very severe manifestations like involvement of the kidneys, involvement of the heart, involvement of various serosa, that are the coverings of the various organs such as the heart or the lung or even the abdominal cavity. So the symptoms of lupus will depend on which of these organs are affected. If you ask me what are the symptoms for SLE, it will depend on which organs are being affected by the SLE. If only the skin is affected, only mucosa is affected, with or without some arthritis, we call it minor organ, because this may not be life-threatening and we require relatively less strong drugs to deal with it. But when it affects the heart, when it affects the brain, or more commonly when it affects the kidneys, then we have to be little more aggressive on how to control it. The symptoms for skin is very simple. You will get the rash, mucosal, you can get ulcers. But when the kidneys are involved, initially it may be asymptomatic. That is, you may not be seeing any symptoms. So any patient suspect of lupus must get tests done to see if the kidney is involved. Only when more than 90% of the kidney is involved, you may get symptoms such as the blood pressure starts to increase, there may be swelling of the feet, there may be swelling of the entire body including the face, and there may be loss of appetite with or without vomiting. When the heart is affected, you get signs of heart failure like the heart beating very fast, there may be palpitations, you may get easy fatigability, walking a little bit, or there may be collection of even fluid inside your lung that may rarely lead to coughing up of blood. When the lungs are affected, there is fluid around the lungs, again it may present as cough or difficulty in experience during breathing. Similarly, it can affect your blood cells, your hemoglobin can go down leading to anemia, your platelets can go down, there can be bleeding from any sites from the mouth, there may be increased bleeding during the periods, or there can be spots over your skin which we call petechiae. And if the TLC or the total blood count comes down, then there may be secondary infection, there may be various viral, bacterial infection which may present depending on the site involved. So the manifestation of lupus depends on the severity of lupus and which organ is being involved. Then how do we diagnose SLE? ANA is not a test to diagnose SLE. ANA is a test which is used to exclude the diagnosis of SLE. You will ask me how? 99.9% of SLE patients are ANA positive. So if your test is positive, you may have lupus, you may not have lupus. But if the test is negative, it is highly unlikely that you have lupus. So again, you have to come to your rheumatologist and you have to discuss your symptoms. The ANA is a very good screening test to rule out lupus. If ANA is negative, you may be happy that you do not have lupus, but you may be having other autoimmune diseases. But if the ANA is positive, we need to do various tests. One of the most confirmatory tests is always a biopsy. If the kidneys are involved, we can do a kidney biopsy. If the skin is involved, we can take a skin biopsy, so on and so forth. And obviously there will be other tests. What is the hemoglobin level? What is your urine showing? So even if you just have a rash and a skin rash, we need to look for other organ involvement that will determine the treatment. So how do we treat lupus? Is lupus going to affect kidneys in all? No. As I have said, a good number of lupus patients may be minor organ lupus. And if we treat them early, possibly we can prevent them from going into more severe forms. And even if you have like kidney involvement, heart involvement, or even brain involvement, today we have drugs good enough to treat these. If you ask me, is there a cure? I would ask you, is there a cure for diabetes? Is there a cure for hypertension? You have to take medicines for long in these diseases and you'll stay well. If you have simple, what you call simple diabetes or hypertension, if you don't take medicines, your kidneys are going to be affected. Similarly for lupus, if you take your medicines properly, keep in touch with your doctors, you'll possibly be very good and you can lead a possibly normal life. But if you stop taking your medicines, ultimately the kidneys will be affected or some other organs will be affected, and that will affect both the quality as well as the duration of your life. A very important question for young ladies who you get lupus is, can I get pregnant with lupus? And actually there are many physicians who advise against pregnancy because pregnancy can aggravate lupus. Yes, it is true, but that doesn't mean you cannot have pregnancy in lupus. If your disease is well controlled, you discuss with your doctor, the disease has to be in control for at least last 6 years. The medicines you are taking should be compatible with pregnancy, and then with proper care, definitely you are going to have a good and successful pregnancy. So what are the outcomes of lupus? If it is only minor organ involvement, we can just give very simple drugs, photoprotection, that is protection from sunlight. The ultraviolet rays from the sun and even from this luminescence light also have a chance of increasing SLE or flaring SLE. So you need protection against UV light, then you need physical activity, and you need a very healthy lifestyle, but most of all you need to continue your medications. And in minor organ, even with minor drugs, you may be leading a perfectly normal life. Even if your kidneys are involved, if you have severe organ involvements, there are much stronger drugs, many more are coming in, and with proper therapy, again, if these are treated in time, even the kidney problems can be fully reversed, then can be 100% reversal of your kidney problems, and you can possibly lead a almost normal life.